Does anybody need closed captioning turned on? I'm getting no's, so I'm going to assume we don't need to do that. All right. So I will introduce myself and kind of the concept, and then I just really would like to go around and do introductions, talk about really what this network needs to look like, even in terms of how often do we need to meet? Is it monthly? Is it bi-monthly? Is it quarterly? How do we communicate in between if we need to communicate in between? Um, and uh, and I want to start off by saying that the concept of doing a disabilities and conditions of aging network, by the way, I'm Jeremy Warner, grew out of really the fact it grew out of my work with Advocates Personal Care, who I'm providing outreach, consulting, and support services to. And through that work, and also my work with some other organizations previous to that during the COVID lockdowns, I saw a lot of networks pop up, some that were really effective and are still going, like the Immigrant Welcome Center's partner call. During that, it was an amazing way to understand what was going on and how COVID was affecting that part of our community. And but then I didn't see anything specific to people with disabilities and conditions of aging. And in working with Ina and advocates, I've connected with some folks, especially one particular case, without getting into any HIPAA issues, but a family with a 15-month-old who had very serious disabilities and needed a level of care that we weren't necessarily able to do. And finding somebody to help that family was a much bigger challenge than I would have thought. And so the idea kind of grew out of that, of that if we had a network of organizations that were focused on disabilities and conditions of aging. And the reason that I keep putting the two together, as I'm sure you all know, conditions of aging themselves present as disabilities. And the more that we can make the world accessible for folks with both disabilities and conditions of aging, clearly the more accessible and the more complete our community will be. So the thought was that perhaps if we got that network built, we would be able to better support those populations by being able to reach the folks who are in need, and by being able to say, hey, we came across this family who needs help, but we're not able to help them. Who else out there can? Obviously, the more we know about each other, the better we're able to make those referrals, even in between network meetings. And I'm not necessarily wanting something where we're doing referrals in the network meeting, but amongst the network. Supporting the people who need help that way is a huge opportunity. I also want to see this be a meeting where we talk about what we're doing in our organizations and how we can support each other, whether it's with the challenges that we're facing or with the celebrations that we really need to focus on. So with that, I'm Jeremy Warner. I am, as I mentioned, doing outreach work with Advocates Personal Care. I also wear another hat. Walking Spirit is my organization. The ultimate goal of that organization is to go towards diversity, equity, and inclusion, consulting and training from a disability lens. I'm also available for public speaking and just simply consulting with people with disabilities about how to modify and adapt to a disability, as I am 16 years down the road of being a bilateral above knee amputee and a burn survivor. And also along with that came type 2 diabetes and severe sleep apnea, because I wasn't exercising enough and I wasn't eating the consistent healthy diet that I need to. And I'm still not doing that part. I am exercising. So with that, I will hand it off to Ina Picard from Advocates Personal Care.
Thank you very much, Jeremy. We appreciate your introduction, and we do appreciate you for sure. And you know, it would be hard to find a better person, a more, appropriate person to advocate for people and to, have a heart for them when people are dealing with challenges. So thank you for doing that. I will just share real fast. My name is Ina Pikar. I'm originally from Ukraine. I came 32 years ago in 1990. I do have my master's in education from Ukraine and then master's in social work here. And I started Advocates Personal Care and Advocates Home Health Care because of the need of my father. Being an immigrant and facing the challenges of trying to take care of a loved one and understand what is available and keep them at home with dignity. So the reason we thought about this networking call is because through years, I personally realized how important it is not just to refer a client somewhere, but to call somebody and actually take their hand and walk them to a person who would be able to assist them. I also realize as a business owner that all of us who are in business, who are in charge of certain positions, have goals and challenges and so on. So I am hoping that this calls will create a good close-knit network of professionals, and that will serve the needs, your professional needs and dilemmas you are trying to resolve by trusting to say, what can you think of that? Or what resources do you know? But also a very close-knit network to help patients and to help clients we serve and to make it good. So thank you everybody for joining, and please introduce yourself. And again, we're so excited that you joined and excited about future work together.
Ina, before we move on, do you want to mention anything about Kids First?
Yeah, I'll just say in a couple words that never in my wildest dreams I was thinking about starting home health care company. I run Kids First Adoption Services, which is an adoption agency, for 23 years. And we placed over 800 children from all over the world. And we're working with domestic families here in this country, families who don't know what their options are. And every family loves their child. Every mother and father loves their child. So anyway, I am running adoption agency and working with biological families. So that's the other part which keeps me busy around the clock. So if you know somebody who needs help, just call and we'll answer your questions. But yeah, thank you, Jeremy.
Yeah, thank you. I will also say Ina has yet to reveal the secret to how she adds extra hours onto the day. It is amazing to get to work with her. So I will pass it off to Amy Nichols, if you wouldn't mind introducing yourself.
Yeah, hi, thanks so much. I'm just excited to be here. I'm Amy. I work for visually impaired preschool services, serving 0 to 3-year-olds with vision loss, and met Jeremy reached out to someone at ARC looking for help for a family, and reached out to Jeremy, who just went above and beyond to give me resources in ways that I could support this family. And I'm just thrilled to be a part of this. I really feel, Jeremy, when you talked about the family with the 15-month-old that you encountered, those are the families who I'm working with on a daily basis that are just overwhelmed to find out that they have a child that wasn't born quite the way that they had prepared for that child to be born. And so they're grieving the loss of the child's what they had anticipated for their child, right? And then just trying to figure out how to navigate the system. And I'm a teacher of blind, low vision. I always am like, hey, I'm a teacher. I just don't know the resources. And so I am thrilled to be a part of this, and I'm blown away by what I've already heard. Meredith Howell is our director at Visually Impaired Preschool Services, and I know she has a connection with Jeremy as well. She really wanted to be here today, but had a meeting with one of our grant donors. So yeah, that's who I am. Ina, when you mentioned your father, my heart just skipped a beat because my father passed away a year ago, and prior to that suffered with vascular dementia for about 10 years, and trying to navigate the system at the other end of life was it's tough. It's tough. And I love how you said we want to give that person someone who takes their hand and shows them the way. Yeah, so I'm thrilled to be here. Thank you.
Thank you.
Wonderful.
I'm sorry for your loss, Amy. It's hard. 1 year, it doesn't matter how many years, it hurts, right?
He was 94, so we felt very fortunate, but yes, thank you. It's still, yeah. Thank you for what you do. It's a huge need out there, and I can just feel the compassion that you have. So thank you.
Thank you. Thank you.
I'm so glad that you joined us today. And I think staying along those lines, I'm going to pass it on to James Michaels so that he can say a few things about both himself and Bosma.
Thank you, Jeremy. Well, I'm the Vice President of Program Services here at Bosma Enterprises. And at Bosma, our mission is creating opportunities for people who are blind or visually impaired. We have an employment side of the house where we hire people who are blind or visually impaired to provide a number of different business line opportunities that we provide. We do medical kitting and package examination, surgical gloves, things of that nature, and opportunities. We have about 180 people who work at Bosma, and half of whom are visually impaired, including myself. So I oversee all of the programs that we offer. We offer employment services. We help people who are blind or visually impaired find jobs in the community. Last year, we placed 26 people in jobs all around the city of Indianapolis and surrounding counties. We also have a community-based program where we help people either to remain in their homes or to be as independent in their home environment after the loss of vision. We serve, and I was really fascinated by this whole opportunity to get together too, because the aging population, as people age, oftentimes their vision does start to diminish. So every year we serve somewhere around 500 or 600 seniors coping with vision loss all around the state. Our goal for that program is just to ensure that people have the ability to remain in their homes if that's what they choose to do. If vision loss happens, which it does to most of us as we age to some level or another, we don't want them to feel like they have to leave the homes where they raise their kids and where they have lived for years just because vision loss has occurred. Sorry about that. That's my phone. We turn that down. And then we also have a center-based program, and we work closely with vocational rehabilitation. And what we do is we have clients come here for anywhere from 3 to 4 months. They have classes. They work with a multidisciplinary team of instructors who help them to ready themselves for higher education or employment. So every year we serve about anywhere between 800 and 900 people. So that's kind of what we do. And if you ever have any questions for us, anything we can help with, we'd be happy to help out. You can contact us at bosma.org, BOSMA.
Did I freeze up? Okay. Thank you, James. I appreciate that.
Welcome.
And if you were not on at the beginning, yeah, James and I both know each other from work with the Mayor's Advisory Council on Disabilities. So he's been a part of this community for a really long time. Let me pass it on to David Love from AmeriCorps.
Good morning. My name is David Love. I am an AmeriCorps member that's currently serving with the Center for Interfaith Cooperation. And my main project is partnership between CIC and NAMI Indiana. NAMI is the National Alliance on Mental Illness. And with that partnership, we host, we deal with the intersection of faith and mental health, basically. Um, Also, in addition to that, and this may be how I got here, because I'm not sure how I got on the radar, but I'm glad I'm here. I'm one of the um, lead connectors for a congregation and congregational care network at IU Health and St. Monica, in case anyone's curious. And I've been doing that for a little over a year. So yeah, there's that. In addition, something that's really interesting for me being here is that I have a chronic illness myself, and my parents are getting older and having um, not only issues with their chronic illnesses, but also mobility issues. So
Okay.
glad
Well,
to
I
be
can
here.
answer the question of how you got on the radar. You and I have been on a couple meetings together, and I had
Okay.
I honestly I was going out on a limb that you would be interested in this based off of some things that I had heard you say in some past network meetings that we were on.
Okay.
I think two different ones within a certain period of time, which is kind of why I noticed that and
Okay.
jotted down your info. That's how.
All right. Well, thank you for inviting me.
My pleasure. Thank you for joining us. Jennifer Muthig, would you like to introduce yourself?
Yeah, great. Thank you. And thank you so much for inviting me, Jeremy. I appreciate being amongst so many amazing, what I hope to call potential colleagues. My name is Jennifer Muthig. I'm the Senior Director of Advocacy and Policy at the National MS Society. Part of my role here is to work on public policy solutions to different barriers to care, whether it's prescription drug pricing, insurance reforms. I really like to think of myself as a connector and an arranger. Within the intersection of our organization, I also work with our healthcare access staff. So those are the teammates of mine that really interact with anybody who does intake at a doctor's office, providers, neurologists, and making sure that they're up to date on all the new MS research that's coming out. One of the things that we're finding through research as the largest private funder of research in the country is, I think typically people have thought of MS as kind of an aging disease, but we're really diagnosing individuals as young as 5. So we have a strong interest in being part of the healthcare solution from not only that young age, but as individuals continue to age with dignity within their home and how they choose to live. I also work a lot with research in our organization, which is really exciting to kind of see some of the new drugs that are coming out in the market that really help people and able to live their best lives possible, as well as self-help groups and then different programs throughout the country, but specifically to Indiana. I do live in upstate New York, so right above Saratoga and the Adirondacks. So not native to Indiana, but really anxious and excited to learn. We have some amazing, wonderful advocates in Indiana, and I'm really looking forward to connecting with everyone here and connecting all the dots. So thank you for your expertise and inviting and sharing with me this morning. I appreciate it.
Thank you so much for joining us. I was going to ask if you would tell us where you were actually joining us from. So, because I think you're probably the furthest away.
In my bunker in the Adirondacks.
Sounds beautiful. Kristen, is it Ludiker Siebert? Is that right?
Yes, nobody gets it right. Good job.
Thank you.
Nobody ever gets it right. Good morning. My name is Kristen Ludiker Siebert. I am the Director of Coordination for a Healthier Hamilton County Systems of Care. So Systems of Care came down from the Division of Mental Health and Addiction. I was on a grant for 4 years through the state and then did an informal merge with Partnership for a Healthy Hamilton County. So we are now a nonprofit We focus mostly on Hamilton County and occasionally the surrounding area because we know that our residents go down into Marion County, et cetera, to get different services. And my position is to ensure that those providing any type of wellness services for any type of member in our community, I know that sounds very large, but that there is a platform to communicate so that groups aren't working in silos and that we can partner across different systems, different groups to fill different gaps that are in the community. Much like David, I absolutely forget how Jeremy and I connected, but I am absolutely here because I know that disabilities and aging are a piece that we're missing within our system of care consortium, our monthly meeting, and our email networks and those that ask to be connected. This is a big piece that we're missing. So thank you so much for inviting me to be here today.
Absolutely a pleasure. Our connection, if I remember correctly, came through a mutual connection at Child Care Answers, who
That's it.
was connecting me to both
Mhm.
you and the Marion County Systems of Care network at the same time. So, yeah,
That
thrilled.
was it. Absolutely. Child Care Answers is on my board. Yeah.
Yeah, and I'm so much looking forward to July's meeting so that I can see what your network is like. So,
Good. Yay. We'll be glad to have you.
yeah. Rebecca Crane, would you like to introduce yourself?
Hi, Jeremy. I feel like I'm kind of already been introduced, not by name, but by what I do. I'm with Advocates Home Healthcare. I'm the Director of Clinical Services. I have a PhD in nursing education, and hospice and home health are my passion. I am so interested to hear what all of you do because I feel like this is a great network that you're starting to build, Jeremy. And even to learn about your walking spirit was interesting. So I have questions for everybody, but I do with Advocates Home Healthcare. We have not just home health care, but we have integrated healthcare, which is where we do more of a case management side to take care of people. We do Medicare waivers, Medicaid waivers, Medicaid, just regular straight up Medicaid to help people in their homes, Medicare, workman's comp. Um, we're working on building our company, of course, as is usual, but not building it because we want numbers, but because we care. And I'm again just very excited to be here. Thank you for inviting me.
Thank you, Rebecca, and thank you for going in more in depth into what Advocates Home Health Care and Advocates Personal Care do, since neither Ina or I really went that far into that. And I do want to say, from the Medicaid waiver side, I'm pretty sure all of you are aware that Advocates is a Medicaid waiver service provider, and that we are focusing on the structured family care and the attendant care, which allows us to pay family and community caregivers of people who are on the Medicaid waiver services. So something that we can talk about more in depth over time. Courtney, and do I have two Courtneys on, or Courtney, are you in two places on my screen? I have Courtney from Fuse, and then I have Courtney Locke, I think, on the phone.
Can you hear me?
Yes.
Yeah, it's just me.
Okay.
My desktop computer at work doesn't have a speaker or a camera, so I'm on one way and on one the other way. It's fun.
So would you like to go ahead and introduce yourself? Tell us a little bit about Fuse.
Sure. Yes, I'm Courtney. I'm the program coordinator at Fuse. Our office is in Greenfield. I'd best describe us as a parent-to-parent organization. We do primarily three different things. We do information and referrals. We do education and training. We met Jeremy because we do a disability resource fair in Greenfield in the spring, and then we'll be in Southport on the south side of Indy in the fall. And we also do monthly support group meetings for parents and provide support and training and education that way. And then we also do some direct programming for people with disabilities. I run an adaptive swim program in the fall. We have an adaptive color start program, a young adult social group. kinds of things. We're open to any age, any disability, but I think primarily what we see is a lot of IDD.
Okay.
We've been around for 27 years now. We were started by 2 moms who had young children with disabilities, and then we are now run by 2 new moms that have young kids with disabilities. My son just turned 10 last week, big number, and he is autistic. And then my colleague Sarah, her son is almost 10, and he has a super rare genetic condition. That's us.
All right. Thank you so much. And yeah, so you know, we have folks from the ARC that were invited, and several other organizations that work with intellectual and developmental disabilities. And the goal here was really to create something that's talking about disabilities across the board and affecting people of all ages. So thank you so much for being on. Going along with that venue of organizations that work with lots of different types of disabilities and different age ranges, I want to introduce Susan Ferguson from Accessibility. There she is.
Hello. Hi, Kristen. I know I saw you wave. It's good to see you again. Hi, I'm Susan Ferguson. I'm the Chief Program Officer at Accessibility. We are the Center for Independent Living for Central Indiana. So we serve Marion and the surrounding counties. As a Center for Independent Living, our goal is to work with people with disabilities to help them to become independent or remain independent in their own homes. So we definitely have that empowerment model. Our consumers are the ones that drive the service and ask for what they need, and we try to meet their needs and meet them where they are. So we are happy to do that and happy to connect. I'm somewhat new to this field, so I'm so excited to be invited to join this group where I feel like there will be a lot of wisdom in the room. So thank you for having me.
Thrilled that you're here. And Accessibility is one of my favorite organizations, as you know. So I actually served on their board several years ago. And then, so there are 2 folks left. I have what looks like the start of an email address, LM Smith or IM Smith.
Hi, yeah, it's Leslie Smith. I am new to the Alzheimer's Association. I've only been there for a week, so I don't have a lot of to bring to this, but I'm super excited to be able to listen and learn from all of you people that just are doing great work all around the state of Indiana. Again, I started last Monday, so I've been doing a lot of training. I am going to be a program manager for them, and I'll be focused mainly in the Metro Indy area and kind of surrounding counties there. So looking forward to this work and helping people however I can.
Thank you so much for joining us, and your newness to this is just the new steps down into a broader world.
Yeah.
And I am thrilled to have you here. My father-in-law had Alzheimer's, so I actually, until you and I connected, had been trying a couple times, well, several times, to connect with the Alzheimer's Society. So glad that you're with us.
Oh, great. Thank you so much for having me. I know you had spoken with Maria and she was not able to be on. So she said, jump on there and get a feel for what's happening out there and how we can get connected. So I'm happy to be here.
Thrilled to have you.
Thank you.
And so last but not least, Kayla from the Immigrant Welcome Center, which really I want to again state that your partner Power Call really was kind of part of the inspiration for what this could grow to be. So thank you so much for being with us today.
Yeah, cool. Happy to hear about, the Power Partner Call. I know that they've been off for a while, but we're restarting them again in a different format.
Good.
Actually next week. So yeah, my name is Kayla. I'm the manager of policy and resource initiatives at the Immigrant Welcome Center. So really my role is ensuring that resources and programs and information are accessible to immigrants, regardless of documentation status or language access. And part of that is, supporting organizations, institutions, coalitions, whatever that might look like, and ensuring and that the work that they're doing is accessible to folks and providing, whatever information or support that I can. Yeah, so happy to see how, yeah, I can support you all.
Thank you so much. And one thing that I did not ask you all to do that I think would be great, because I realize I'm the only one who has all of your email addresses. So if you would all please put that information, your contact info, into the chat so that all of you know how to reach out to one another, I would appreciate it. And really, so I think everybody probably already understands the basic concept of why we wanted to put this together. But I really wanted to spend some time getting your thoughts and ideas about what this network really needs to look like. From how often do we meet to, like I said, how do we communicate, and what information do we share? What do you want it to be? Because I, while I think it's important to do presentations from time to time, I also realize that some of these network meetings have a habit of becoming what is the flavor of the month presentation, and I've seen that they don't necessarily continue on and do much from there. So like I said, I want to see this be something where we're really able to help the communities that we're all here to support.
Yeah, I appreciate you, Jeremy, raising that subject, because that's really the key. We want to make sure we realize that all of you are very busy people, and to devote an hour of your very busy day is, we are very flattered that you chose to join us. So we would so appreciate your input. What would be helpful to you? You have so many experiences, and I'm sure participated in other calls and stuff like that. Like, what would be beneficial for you in your role? How could this group be helpful and worthy of your time? So please jump in.
Ina, may I start, please?
Yes,
Just
please.
in that, what would really be helpful to me and hopefully to you as well is to hear from each of you. Give us an example of why would I connect with you? What can you do for my clientele, for my business? For instance, the Alzheimer's, I'm really interested in connecting with that, David, with your connections in mental health. As you know, there's a lot of people with different mental health issues that are in the community, and a lot of them are receiving home health and helpfulness. MS, we've got patients with MS. All of these are so interesting, but if we could get in a little bit more details about, here's what I look for, or here's how I can help specific more. I mean, we started with it today, but maybe a little bit more specifics would be helpful to me.
Thank you, Becca.
I think I would throw along with that, whoever wants to jump in. In addition to, what we can, what is helpful to you guys, and, what is helpful to us. Also, when is the right time for us to meet? Is this a good time? Did we hit the right time out of the gate, or do we need to look at a different day and a different time? So. Anybody brave enough to
And
go?
I guess another question is once a month reasonable? I mean, in my opinion, it is, because if you do it more seldom, it's kind of harder to keep in touch and remember. And if you think like once a month, I jump in on that, but we want your feedback. And yeah.
I like the idea of once a month. I think even just having something on the books so that way it's consistent and we can be intentional about that time together. And if there's something not happening, or maybe it's, we do it over email, but I do like the idea, of having something, once a month.
Okay. Thank you.
This is James. I would agree with that. And actually, this time slot for me tends to work pretty good. Another suggestion I had is we want to keep recruiting more folks. I'm sure, Jeremy, you're thinking about that. But also too is maybe at each time we have one of these, maybe somebody would we could do like 15, 20 minutes from a specific organization and just do a case study. Here's what we've done and here's what we did to help this person. And of course, no names, omit those kinds of things, but just an example of some of the services that you provided.
I love that.
That's great.
I was going to mention just in regards to the day and time, the day is great. I have something in person at 11:30 though. So even if we could start like 30 minutes earlier, that would work better for my schedule, but that's just me. Like this time slot works. That 11 to 11:30 though, maybe pushing it for my 11:30.
Okay.
Should we do it at 9:30? Should we schedule this calls at 9:30? Do you think it's kind of gives you a chance to come to the office, kind of look through your emails and then jump in?
I always think these are funny questions when you ask the people who are here at this time if this is a convenient time, because apparently it was. But for the people that, so it might be something to, well, it works for me, it's a good time for me, but if it might be worth doing some version of poll to the people that you really want to be in the meeting as well and asking them what would work well.
Yeah, the one thing that I'm not strong on is doing the tech stuff like the Survey Monkey things, which I know are out there, or doing a doodle, which I've but I don't necessarily know how to do those things. If anybody in this group has those skills and would be willing to let me rely on them, I would love that assistance.
Survey Monkey's really, really easy, Jeremy.
Aha.
I'm sure that even you could do that, but I'd be happy to.
Thank you. All right, we'll be in touch. Okay.
Yeah, I would love the, for other working groups I'm part of. I guess it depends if it's like a working group or like more of an informational group. For informational groups, I generally meet like quarterly, but regardless, for all of those groups, I would love to chat more about how you all could support with work around municipal IDs in Indianapolis. I know people seem to be in a lot of different places, but would love to see how what insight or support it could look like in coalition with supporting municipal IDs. I have like a formal presentation, so if there's an opportunity for something like that in the future, would be happy to present about that.
Okay, and I was going to say, Kayla, I think that is a huge piece of what you can bring to this is us understanding, how do we help people who are part of the immigrant population that aren't documented, who need support? How do we help? I know there are some organizations on here that for instance, accessibility, the only thing that they need for somebody to be eligible for their services is for you to be able to say, I have a disability and this is how it affects me and I need your services. Whereas there are other people on here who I know would require documentation of citizenship to be able to provide services. So I think that's a huge thing for you to help us understand. So yeah, I would love to talk with you about having you maybe present about that at a future meeting here. Good.
I have a question as well. I mean, like, when I'm thinking about the group, like, I would love to have, and please tell me if it's just me or everybody else feels that way. I feel like as a representative organization, I would want to make sure that, for example, if we have a challenge or you have a challenge with something, either recruiting staff or need resource regarding something, that we could be a support for each other from that perspective and kind of leave the floor open to people to say, do you have any experience? For example, I mean, we are always dealing with scenario where we need good, reliable caregivers. And like, we had a meeting today and we were saying we need to hire people who are, home health aides or, to take care, because we have 2 patients out of this morning who desperately need help, and we desperately need people who would provide this consistency. Like, who do you think we should reach out? What worked for you? I mean, this is just an example, or, or maybe you have another issue in your organization, or, we have a challenge. So many people are caring for their loved ones. What is the best way to make it easy for them to understand that they could actually be hired and use this time? I mean, you might be having a different dilemma. Just to kind of have discussions and brainstorming how we could help each other with different dilemmas. I hope confusing thing.
No, that's, I mean, absolutely. That's kind of what I would like, whether it's, and it depends on how big the network gets. I mean, with a group like this right now, we can go around and talk about the fact that yes, right now advocates needs HHAs and CNAs. And we can talk about, that family that we came across that needed support and try to find the right place for them.
Because you might be looking for a family who is looking for a job, right?
Right.
Or something like that.
Absolutely. So, yeah, I mean, I think that is what I would like to see us doing, is not just introducing ourselves, but saying, right now, this is what we're looking for. If we're hiring people, if somebody is trying to find jobs for people with disabilities, being able to say, I have 5 people with disabilities who need to find work. And maybe there's an organization that is able to say, we are hiring. So, yeah.
Or I have a patient I am caring or working with a family and they're dealing with this issue. Do you know of any resources? We're just throwing examples, and yeah.
Yeah. So, so far I have 3 votes for monthly, 1 for us looking at 9:30 and the idea of doing a doodle poll. So we will, between Rebecca and Susan, you guys are going to help me figure out how to do that. So, and other thoughts at the moment. I know we have maybe 12 minutes left in the hour that I was looking at taking out of your day. I would love to hear other ideas and thoughts at the moment. 10 works for the Immigrant Welcome Center. That's good. Oh, I need to stop moving my mouse because I almost canceled the meeting. So, so anybody have any other thoughts, or do we want to wrap up early and everybody gets to steal 10 minutes out of their day? I see Susan nodding her head. So, okay, then I would say, let's see, Courtney, monthly, if it's short, hour or less. Courtney, and so I don't know if we're going to still have the chat when we end. So I want to look real quick to see if there's anything else in here. Did everybody get their email addresses in? Everybody see what they needed to see? I see something I need to write
And
down.
somehow you can save the chat, but I don't know how to do that.
Yeah, see that this is where, so I walk on a pair of robotic prosthetic legs. They have an artificial intelligence. They're absolutely amazing. And so everybody sees that and they think that I have tech skills. Not at all.
Just your legs?
Just my legs. Yeah. So my legs have the tech skills. I do not. The fact that we are even on this is amazing. So, but yeah, let's see here.
Hey, Jeremy, this is James. When you send the invite out, is it okay if we forward that to other colleagues that we think might be interested in participating?
Yes, thank you for taking me back to that before we leave. That is something absolutely. I want to see this grow. I don't have your contacts. So please, I mean, I'm sure that there are some that cross over, but please invite your colleagues, invite folks who have an interest in the disability community. Even if they just want to tune in and learn, that's important. But yeah, I think having a regular conversation about what we're doing and how we can support each other hopefully leads to better coordination and better support for the populations that we're here to serve. So Thank you all so much for joining. Any last thoughts before we wrap up? Since I don't know how to save the chat, grab what you want out of there before it's gone. So, okay. Thank you all. I hope everybody has a wonderful weekend coming up. I will shoot for probably either one of the last 2 weeks of July to do our next meeting, and I will try to keep it on a Thursday unless we get something really drastically different out of a poll, if I can figure out how to do that this month. So.
Yes, thank you so much for joining. And yes, please spread the word and send it to people. And if things come up, shoot us texts. And again, have an awesome day. And thank you again.
Yeah, and if there's anybody that you guys are working with that we can help, or that you think we might be able to help, asking the question is better than not. So, and same thing, I'll be reaching out to you if I find somebody that I can't help. So, thank you very much.
Thank you, everybody. Have a good day.
Thank you.
Thank you.
All right, be well.
You meet everyone. Have a great day.
Thank you. Okay.